Okay. Brother Lewis, the question you just asked about is there anything I can eat or we can eat to reduce our cancer chances? I said, yes, sir. Of course. As you well know, our DVD interview with Dr. Neil Nedley, how he explained the 80% chance we have of not getting cancer by eating carotenoid foods. And of course, the carotenoid foods is those foods of every color under the rainbow. That is low fat, fresh herbs, fruits, fresh vegetables, and vitamin A, B, C, D, B12, B6, zinc, potassium, iron, pomegranate juice, and these kinds of things. And it should be a regular diet. And these are the kinds of foods that, remember, the body is a natural organism. And you can't put dead food in a natural organism and expect the optimal operation. As well as your brand new car. You can't put the wrong gas in it or it won't work effectively. You can't please stop putting the proper oil and fluids in it, or after a while it just stops. So I said increase your food like twofold, tomatoes, tea, red grapes, red wine, fresh grapes, juice, strawberries, raspberry, peas and beans, watermelons, rosemary, garlic, onions, omega-3, 6, deep sea cold water salad, that kind of thing.
Well, can I take just supplements for these foods rather than the foods itself?
Well, that's a big shortcut. It's better to eat the natural food source for the beneficial substance and antioxidants, but use the supplements as well. They are called supplements, not replacements.
Okay. What foods should I avoid?
Let me say, it's a long list that I do not have here, even a long, long list. Again, especially if there's a problem with cancer, avoid red meat, beef, pork, and lamb, sugar products, soft drinks, such as Cokes and 7-Ups and the many sugary drinks, milk and fat foods. Also, as Dr. Nedley stated, one charbroiled steak was equal to 600 cigarettes because of the carcinogen, purine, and uric acid in that product. Now that seems extreme.
Wow.
But what he's talking about is what's in there when you charbroil the meat, and the fact that I was an executive chef and cooked a lot of steaks, not only professionally but in my backyard too. The fat and the smoke and the things from the charbroil gets into that steak, and it doesn't happen overnight. It happens over a period of time. If one has a problem with prostate cancer, be sure to use natural herbs that include saw palmetto, pythium, africanum. One can actually find 16 supplements in one capsule or tablet because the prostate gland itself needs this nutrients. And a lot of times when we eat, we don't think about what the food does to our body and all those thousand trillions of cells and various parts. We just eat it because it tastes good or smells good or we like it. Even if you don't like the food and it's required to feed a part or organ in your body, that's the food you should learn to eat. Make it taste good.
Great. Can you explain some of the symptoms of prostate cancer, and are there false positives?
Yes. Prostate cancer progresses from a small point, at which time the tumor is small and has no effect on surrounding tissues and organs. But it progresses to a size where it affects the body in numerous ways. In stage 1, where it has not metastasized, that means it has not gotten outside of the prostate gland into other areas, This is where you and the doctor can manage it most effectively. Once it has become metastasized, we call this metastatic cancer, that it gets outside of that gland, then there is a serious problem of containing the spreading to other organs and even to the bones. Now, let me see, Brother Lewis,
Okay.
perhaps.
Here it has the symptoms vary from one person to another. Frequent urination, pain for some. Others, no early warnings. It usually grows very slowly. From some, it is aggressive. That's why it's important to have a routine annual exam or every 6 months if necessary. Always include PSA blood tests.
That is very necessary simply because we talked about the DRE, and I think we mentioned that in our further discussion, which is a digital rectal exam. That's very important, especially because of the prostate where its location is. The doctor and he can do this in 3 to 5 seconds, so it's not something that men should be concerned and get all hung up about. It's a 3 to 5 second procedure that can detect abnormalities years before the symptoms develop and should be a regular part of your visit to the doctor. Every man over 50, along with a medical exam, urine evaluation, and a PSA. The doctor can feel and detect any abnormal thing going on in the prostate. The test is called a DRE. It's a digital prostate examination or a finger wave.
What is the doctor trying to feel by doing this exam?
He feels any area of firmness, hard nodules, lumps, or irregularities, any areas that are not soft, smooth, and symmetrical.
Now, after these exams, and no cancer is found, am I, what you say, in the clear?
That is a very good question and good news, but nothing is 100%. And if you are over 50, it will still be wise to repeat these exams every 6 to 12 months. The test could have missed the cancer somewhere in the prostate gland. The same as it can say there is cancer, meaning it could be a false positive. It doesn't mean every time they give you a test that what they say is what it is. It's just humanly impossible. That's why it is so important to continue these tests.
Can you tell us something about the stages of cancer?
Yes, let me see if I can do this quickly. When we talk about how much cancer is in a patient's body or exactly where it's located, we are referring to stages of cancer. That is determined by the biopsies or other exams, whether or not it's on both sides of the prostate, or again, if it has metastasized out of the prostate area. Now, when we say stage 1 or A, it means cancer can be found incidentally because of an elevated PSA. In stage 2, cancer can be found because of abnormal digital rectal exam, but confirmed to the prostate gland. And stage 3, cancer spread to tissues outside of the prostate. And stage 4, cancer spread to the lymph nodes and to the bones. And that's very possible. So yes, you can tell that.
What does the stages tell us about long-term results?
Okay, let me see, can I answer that question? Basically, the more cancer that is in the body, the more potential for spreading to other organs and more of a problem in treating. Remember, science says there are 100 trillion cells in the human body. God made the body in such a way that the cells are renewed every 11 months, and that at 60 to 70 millions of these die each day. So, the timely rotation becomes abnormal cells to find a way to metastasize in other organs in the body.